Good evening, dearly beloved sisters. Good evening, everyone. You are welcome to Tabitha Health and Wellness Community Forum, where we discuss about health. I want to welcome every one of us to another edition, and I'm believing God that it will once again open our mind to understand the principles of healthy lifestyle. For the purpose of those who are just joining us, I want to welcome you, and I want to also introduce you formally to the community. This is Abita Health and Wellness, like I said earlier, and it's an online community where we come together as women to share the truth, especially in God's perspective, God's way on how to stay healthy and how to also maintain our energy level so that we can fulfill God's purpose for our lives. So you are welcome. Again, in this community, we do not diagnose or treat any sickness or any disease, but we purely discuss health. We educate people, and then we give advice on certain things that we can do to help us to regain our health. And therefore, because of that, if you have any health issues, I want to encourage you to see your physician or your trusted healthcare provider so that you can get adequate medical attention. And I'm trusting God that everyone that is in one experiencing one health issue or the other, be rest assured that God is with you. His mercy will continue to speak over you, and then you will recover and you will have great testimony. So let me try to give a little explanation to each one of them. I won't rush this series because I really want you to enjoy the series. I want us to take out the fear whenever you hear blood pressure. Some people, when they go to the hospital and they just said, "Have you checked your blood pressure?" Immediately, their hearts start pumping, their bodies are shaking, they are, and the pressure can even go up just because they said check your blood pressure. Some people are already looking and panicking. There is nothing to panic about. So I want to make it as simple as possible for us tonight so that we are not subjected to fear because you hear pressure, okay? So uh, I'll take it slowly and then see how far we can go tonight. Then I'll continue later. Of course, I can't finish it tonight because I'll continue later, and then we will believe that you will have clarity by the time we are done with this series. So now, whenever you hear the word blood pressure, okay, you shouldn't panic. You should not allow your heart to be troubled. Okay, you should know that for men to be a living being, there must be pressure. Okay, so take it like that. There must be pressure. What did I say? You can say it again for me to hear. There must be pressure. Okay, so for us to have to be a living being, there must be pressure uh, among within this particular thing system, the heart, the blood, the vessels, and all of that. There must be pressure. So now, what does the heart do? So the heart is that engine of the body, is the engine of the man. That's the power. They call it the powerhouse. Okay. So I don't know which one we will call powerhouse now between the heart and the kidney and the liver. Now the heart is a power because when the heart stops pumping, then maybe the end of life. Okay, maybe the end of life. So the heart is that engine of the body, and its the major responsibility of the heart is actually to ensure that blood is pumped. Okay, the blood is pumped, right? So we'll leave it like that. Blood is pumped. That's the major responsibility. So the heart pumps the blood. The heart pumps, there's pumping. Like I said from the beginning, the pressure and the pumps. So now we move to the vessel. Okay, before I go to the vessel, the heart, when it's pumping, okay, it's supplying certain things, supplying life. So your heart, when the heart stops pumping, that means the heart stop, the life of the man ceases. When the heart stop pumping, that means that there is no life again, unfortunately. When the heart stops, it is they check the heart and the heart is not pumping, there's no pressure, there's nothing, there is no pulse, okay, the person has gone. Okay, the person is gone. So now let's move to vessel. The vessel is, like I said before, the vessel is that container. The vessel is like, these are the channels by which the blood that is pumped by the heart. Okay, when your heart pumps the blood, it takes it. It doesn't pump. Your heart is not the one that distributes the blood by itself. The heart has to pump the blood into something, a vessel. Those vessels, okay, that part the arteries, that pass it to the arteries, and the artery takes it to the right channel. Okay, so that's it. The next one is the blood. The blood is that red liquid serum that is pumped by the heart. That is the blood. The heart pumps a liquid, a red liquid, which is the blood, pumps it. When it pumps it, that thing that is pumped is the blood. Okay, your blood carries oxygen. Your blood carries oxygen, and oxygen is needed in every part of the body system. For you to be a living being, the oxygen must be rightly circulated into the body. So when you have low amount, look at it now, when you have low amount of blood in your body system, they will say, oh, the PCV is low. Okay. When the PCV, so many things can make PCV to be low, and that the heart too wants to pump blood. That can also be pressure for the bone, because there's no enough blood for the heart to even pump in the first place. You getting me now? So your kidney, they do this extra work for you. They remove waste, they remove extra fluid. Okay, and when this is done, blood pressure would automatically be taken care of. Now, the blood pressure depends on how much fluid, water, salt that is available in the body system. Simple. Simple. The blood pressure depends on this a lot. Partly depends on this a lot, okay? For it to function, and you will see it as we go on. So if your kidney keep too much salt, your kidney keep too much salt and water, your blood volume will increases and raises your blood pressure. Okay, it raises your blood pressure. If your kidney excretes and excrete water, excessive water, and excessive salt, excrete them excessively, the blood pressure, the blood volume will decrease automatically. And what will happen? The blood pressure will lower. Okay, so it's something that I want you to follow me. You will be getting some understanding of the treatment plan that they put high blood pressure patient on. So see, to help them to stabilize and to bring down the blood pressure. Now, I want you to note something. Your kidney, see your kidney as a tap. Your kidney is at the top. I'm not talking about kidney basically as a topic, main core topic today, kidney issues, but I'm talking it in relation to blood pressure. It's okay. So for water, so it had just your kidney is like a tap. See it as a tap that help you to regulate water. Okay, regulate water like your tap water in the house. When you turn the knob right or left, it brings water. When you turn it left, it closes up, depending on how your regulator, your tap water tap regulator is. So it helps to adjust the amount. You can also adjust it, how much of water that stays inside the tap or that flows out of the tap. So the same way for your system, the kidney, the vessels are in there, they takes in the blood. So your kidney is like a tap, a regulator that actually takes how much water much fluid that is available in your body system. Okay, so then your kidney helps to moderate and regulate hormones. There is an hormone that is released by the kidney in order for the functions, in order for you to function properly. And that hormone, the kidney, the very hormone, and the hormone is called renin. Okay, renin is very critical for kidney functioning. If you are with me as I teach, kindly listen and also drop your emoji. Don't just drop emoji again. Please listen and follow me. So tonight I want to share on what I have titled Understanding Blood Pressure, Understanding Blood Pressure, okay, as women. And it is one area, one aspect that I think is very important for us to talk about as women, because there's so much out there about blood pressure, and it is important for us to have basic understanding about this particular topic so that we don't go on with wrong notions, we don't go on wrong with wrong information that can impact negatively in our health. Okay, so when we say blood pressure, okay, I want you to understand that um, we are basically talking about pumping and pressure. Okay, pumping and pressure. So it comes to your mind. So we're not going to use, I'm not a medical doctor, okay? So I'm not going to be using so much of medical grammars and medical terms. So I will be using layman um, and words of something that will be very simple. I will use something that will be very simple for you to understand tonight, okay? So when we hear blood pressure, what should come to our mind is pumping and the pressure, okay? Pumping and pressure. And when we talk about pumping and pressure, what does that mean? Okay, so if you hear pumping, your pump, pumps and pressure. Okay, so that's what blood pressure. That's where the word comes from. Blood pressure. Okay, pressure. There's a pumping. There's also I will explain further. So there are certain organs and systems that are responsible or that you can't you have to mention that are involved when it comes to pressure. Okay, when it comes to pressure, there are some organs that are very important. What are these organs or what are these things? The first one is the heart in a particular order. Okay, so the heart is one of them. The other one is the vessel. When you say vessels, okay, I will use, like I said, I will use something very simple. So now you have those lines in your hands. When you want to take blood samples from you, I'm sure they will take a needle, ask you to fold your hands. They want to try to locate veins in your hand. Okay, so you have veins. Those are the vessels. You have arteries. You have capillaries. You have different kind of vessels in the body system. All right. So you have them. We call them generally we call them vessels. So vessels are like uh, just like every other vessel that you have at home. They are like containers, okay? They are like channels. They're like things that you use to fetch water at home. There's some things that you use to, as implied, there are different vessels. For us as Christians, the Bible talked about, yeah, different vessels, um, and there are various vessels of honor and vessels of dishonor. So here we're talking about vessels, something that that like a container, like a channel through when you do something, you carry something. Okay, so I will talk about them briefly very soon. Then the other one is the blood itself. You have the blood. Then you cannot also talk about pressure without talking about the kidney. So now, when we are dealing with pressure, we cannot we can't do without talking about the measurement when you're doing the measurement. So let's talk about the measurements now. Now, when you have um, to measure the pressure, you need to consider the pumping of the blood into the vessel and the receiving of the blood into the heart. The heart also receives blood. The heart also pumps blood out. Okay, the heart receive deoxygenated blood. That is the blood that doesn't have oxygen in it. That which is collected, that which is supplied by the vein, because the vein is the one that carries the oxygen, the blood that doesn't have oxygen inside, right? So it supplies it. So let's not go into those details, too much details. The blood takes blood. The heart takes blood, and then the heart also pumps. So when you hear things like boom, 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 the top and the down, the systolic, is the pressure of pumping blood inside the vessel out. And the diastolic is the down part. That is how the blood takes in, the heart takes in blood. Okay, that's usually a resting moment, not a pressure as such. There's no much of the pressure inside. That's why it's only like it's like in a resting mode. So there is the distribution of the blood, the pumping of the blood, and there is also the receiving of the blood by the heart. So at every point in time, the way your body, your heart pumps the blood, it must be regulated, because it can be a problem as well. And the way your blood takes the blood must be well regulated. Now, if your blood, if yeah, the way the body pumps the water is the one that they call systolic, and the way the body receives is what they call diastolic. Now, the one that is diastolic, let's go to the numbers. We went over. WHO says that the number that is within the range of 120 over 80 is taken as what? A normal. Any number that is below 120 and above and below. So any number that is above 120, it is speculated or say that the person is getting into pre-hypertension. You just want to know it's getting elevated, right? It's getting elevated. Then the pressure that is above 130, it is regarded as the pressure that is elevated, that is well elevated. And any pressure that is also below the number of 90 to below 90, it is regarded as low blood pressure. Now, this is how it is: 90 to 120, right? That's for the systolic, the upper part. Okay, that is the one, the way the pressure of the way blood pumps into the heart should be about 90, between 90 to 120. That is what we just say it is normal range. Then the receiving of the blood is diastolic. The blood is called, that's one of the receiving the blood, which is uh between um is between 60 and 80. So any number that is above 80 is regarded as getting elevated, that the person begin to look into that critically. And any number that is below 60 for diastolic, it is regarded as a low number. And any number that is systolic is lower than 90, this is regarded as a low number. I don't know if this is clear enough. If you have low blood pressure, for instance, now, it means some people are just getting weak, tired, fatigued, and like that. You don't want to be quiet about that. If you feel that consistently, please stop by and check. Just stop by and check your blood pressure. Sometimes when I feel some maybe uneasy, the first thing I go first to do, I'll go and check my blood pressure. I'll check my blood pressure, okay? Sometimes when I see that my blood pressure just went low, not that it's low, 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 low. I'm not usually a high blood pressure person, really. So when I see my number, I say, okay, I've not eaten, or no, I'm just like this. Okay, okay, I've not eaten, or just I've been fatigued yesterday or something. So I'll quickly know what to do. So it's important. Don't let us gloss over it. Because we are Christians doesn't mean that we should not check our blood pressure. We must constantly check our blood pressure and ensure that our numbers are within proper range. Why should we bother about the pressure? Why should you bother about the pressure? We need to be concerned about the way the body pumps blood into our body system, like I explained. It is as simple to understand based on what I explained earlier. Now, your body shouldn't supply less of blood. The pressure shouldn't be less. If the pressure is less, the way the body takes circulates oxygen, because the body needs oxygen every minute, every second. So if it is low, it's going to affect quite a number of things. It is high, it's going to equally affect quite a number of things. The one that is very, when it is that is very, very important for us to note is that that's why we call high blood pressure a a silent killer, because it doesn't give notice, right? It doesn't give notice. And if uh, the pressure is high, to certain level, like a critical and an emergency situation, they call from 180 and above, okay? And then over 180 and above is a critical condition that is called an emergency situation. And you want to believe that if you have that kind of a situation, you just don't want to be quiet about it, okay? Now, when you have this blood pressure, why do you think it's very important for you to avoid having high blood pressure? One, you need to consider the aspect of your heart. One, the heart, the kidney, okay? Also, the very important one, stroke, the stroke. It can cause stroke, it can cause heart problems, heart failure, right? It can cause all of that. It can create stroke and the likes like that. Can also damage the kidney. Constantly pressure, high blood pressure is also, there's always a link between the high blood pressure and the kidney. When you consistently start having a high blood pressure above 140, you want to consider checking your kidney. Some people, once they get and work on the kidney, they find out that the high blood pressure will be what normalized, because it is the excretion process of the kidney that is actually giving them the high blood pressure. And it's also the excretion that lower the high frequency of release excreting sugar, salt from the body system, that is also might be causing a lower blood pressure as well. Either of the two, it's not something that we should overburden ourselves about, but we just need to know our numbers. This is where I want to talk about, because you know that high blood pressure is not something that you can gloss over. So you need to know your numbers. How do you know your numbers? I've said it before. Please get a machine for yourself at home. You need to have a machine at home, please. Either you have, some people don't even know that they have low blood pressure, and they don't even know that they have high blood pressure. Please, I know we have a lot of uh, faith people here. We have a lot of believers, loving, God loving people on this platform. I want to encourage you to please invest in your body, in your health, in yourself today by buying a good high blood pressure machine at home. You don't have to have home run, okay? You don't have to have the high end ones. There are other good brands that are affordable that you can buy and keep at home. Please don't over spiritualize this issue of blood pressure. I am begging you. That's why I don't want to rush this series. I'm going to really go deep into certain areas so that you can understand some things about blood pressure. Blood pressure itself is not the problem, but it is the the attention we give to it, and the way we respond to it is what actually makes the difference. It's not so much of it's not so much of fear. When you hear blood pressure, started getting afraid. When you say high blood pressure, they can all be taken care of. I'm telling you, they can all be taken care of. When you notice certain things, now you understand that you have understanding, deep understanding of the reason why pressure is important. Your blood needs your heart needs to pump. Your heart is not pumping and the normal pressure. That means that it is either high or low. you know the implication. What it means that oxygen will not be properly set. So, for instance, if you have low blood pressure, for instance, the oxygen is the life in the blood. The oxygen is the life in the blood. And so, when you say when the heart stops pumping, there is no oxygen because it's that heart that pumps blood, that circulates, because nothing, whatever system, anything that is working, once the heart stops, there's nothing to carry oxygen to the body system. Because when you have, so the oxygen to will stop, okay? Oxygen will stop. And when somebody loses oxygen, there's no circulation. And that is why when somebody is about fainting, the heart, you see the heart start to do something, or somebody is feeling like unconscious, there is something that the heart begin to do. The heart begin to beat fast. Boom, 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 boom. That is, the heart is beginning to supply blood to that part of the body system so that the oxygen can be circulated and there can be what? Gain, the person can regain life again, can gain life again. So it is important for us to understand this simple process step of the body system. Now, let's move to the kidney. The kidney is an essential part of pressure as well. Okay, when the blood, the kidney is the one that filters the blood. It removes toxins and it removes waste. Okay, the blood, it removes toxins and remove waste. When there is, and of course, when there is excess water and salt in the body system, there is retention of water and salt in the kidney. What happens to the blood? The blood that is being pumped out, the blood that is coming to the body system has excess water, has excess salt, and that will impact on the pressure. That will impact on the way that the heart is pumping blood. Okay, so now when you already ascertain the pressure is the pressure and the pump. So when the kidney also have excess water, it can either create it, that brings about the pressure in the high, and then when the kidney also excretes excess water and salt as well, the pressure will be low. I don't know whether this is clear. Is it clear? So as simple as this, we just need to understand it basically. So now let's go to what we are talking about, pressure. Now, when we are talking about pressure, the pressure can either be high, the pressure can either be low. That is why you hear high blood pressure and what you hear low blood pressure. Now, it means that, what are we talking about? There is a system in place, the system of the heart pumping, boom, and the heart pumping out, okay, and circulating the blood, pumping the blood into the vessel. Now, so when that is done, it's meant to be, of course, doing the work normally, regulating, well regulated pressure, nothing like high. So there's a high blood pressure, there's a low blood pressure, and of course, there's a normal blood pressure. I hope it's clear. So when people are telling about blood pressure, just know that it's a high blood pressure, low blood pressure, normal blood pressure, because now you understand that there's something going on that can create, that there's something going into the system that should be pressure, of course. There will be pressure in your body system. The pressure is either normal, it's usually high or low. So now let's go to it, how they come about low and blood pressure. Now, there is something in measuring the blood pressure. There's something we call the systolic and the diastolic. Okay, when you are measuring blood pressure, you see, there's one, they call one on top, there's one down. When I'm asking some people, I said the blood pressure, they will say, the 120 over and the 90 or so, the down one is this. They can't even differentiate. They don't even know, Jerry, and they can't even differentiate between low and the one that's up and down. So I will explain it now. So I've started the introduction today. I don't want to I don't want us to rush this particular topic. I want us to take it one step at a time and give us a very fine breakdown on blood pressure and build on them and build on what we've talked about tonight. And then we will see how easy, by the grace of God, to manage your blood pressure, to reverse your blood pressure, to get your blood pressure under control by the grace of God. And we'll be talking about that and be talking about lifestyle adjustment, things you can do, things you can work with. We have seen people, I say it categorically, people who have reversed the high blood pressure naturally, I'm telling you, and they are no more on their drugs. I am not talking about faith based dropping. I don't know. I know some people have done faith. God is able to do miracle. I'm talking about people, not people who said they don't want to take their blood pressure by faith and yet their blood pressure keep rising. Not that style, not that method. I'm talking about the God given wisdom approach in doing this. Guess God's wisdom and God's wisdom approach to healthy lifestyle, a lifestyle, okay, that we can reverse many of these things. Because why? God is a God of mercy and He knows how to come through for us in every area of our lives. Even when we have heard or when we have come short of His glory, we disappointed Him through our lifestyle or something, He knows how to come through for us. Only if we are ready to go with Him. If you are not ready to go with the Lord, then we may remain where we are. But if you're ready to make up your mind to go with God, I'm sure, 100% sure, that God is ready to work with you and to ensure that you are back to the normal, the way He created your body system, and your blood pressure will be normalized, and then you will live a happy and then drug-free life forever. There are people on this platform that are enjoying that grace. There are people whose doctor, their cardiologists have told them to actually stop their drugs because their blood pressure kept on dropping consistently. And if you maintain that level, if you maintain that particular standard of God, because it's God's standard, if you maintain God's standard that way, you will be amazed at the same and the miracle that God will do in your life as well. So, see, by the grace of God, till we meet next week, let's keep obeying and then trusting and working with God in regards our health. And I see us having testimonies, abundant of testimonies concerning our health. Thank you and see you next week as we begin to build on what we started tonight.